Meeting is called to order.
Welcome into another edition of meeting. And I request President Sir to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated, and as we have not received any objection or observation, I presume that all of you have confirmed the minutes. So I hereby confirm the minutes of the previous meeting.
Thank you, sir. Today we have a special guest with us. She is from Indore, Dr. Isha Tiwari Arora. I request Rotarian Dr. Moniz to give her an introduction. Dr. Moniz, over to you.
Yes. Good evening, everybody. Good evening, Mr. President, Secretary, and our fellow Rotarians. Today it's my proud privilege to introduce to you our guest speaker for the day is Dr. Isha Tiwari Arora. That's Mr. Avinash.
Yeah, please.
So Dr. Isha is presently a senior consultant nephrologist and a kidney transplant physician at the CARE CHL Hospital at Indore. Dr. Isha has completed her specialist training in nephrology and renal transplantation at the prestigious Nizam's Institute of Medical Sciences, Hyderabad, which is home to India's largest nephrology department. Now, throughout her distinguished career, she has contributed to over 250 renal transplant procedures, which have, while actively championing preventive nephrology initiatives across the region. Her main expertise is into glomerular diseases, and Dr. Isha has performed more than 1,000 renal biopsies and holds a fellowship in glomerular diseases also. Dr. Arora currently serves as the Secretary for the Central Zone Chapter, Women in Nephrology, India. She focuses on pediatric nephrology with a special interest in conditions such as nephrotic syndrome and genetic kidney disorders. Her areas of expertise include renal transplantation, advanced procedures into interventional nephrology, critical care nephrology, renal replacement therapies, and research interests are into IgA nephropathy, innovations in renal transplantation, and genetics of the pediatric kidney disorders. Dr. Isha ji, welcome to the Rotary Club of Organ Donation International, and over to you, madam.
Thank you so much. Good evening, everybody. I'm humbled by the introduction. So I'm Dr. Isha, and I'm here to talk about comparing dialysis and transplantation today. So since the very beginning, since the time I had chosen nephrology as my branch to be pursued all through my life, I always had a vision that transplantation is something which needs a lot of focus in our country. मैं आप लोगों से दोनों ही भाषाओं में चर्चा करना चाहूंगी क्योंकि जो बातें हमें दिल से करनी है वो हमें अगर मातृभाषा या फिर हिंदी में की जाए तो शायद वो ज्यादा गहरे दिल में उतरती हैं। सो ट्रांसप्लांटेशन मेरे दिल के बहुत करीब हमेशा से रहा है। मैंने अपने परिवार में कुछ ऐसे लोगों को देखा है जब मैंने मेडिकल को MBBS को एम्ब्रेस नहीं किया था। Since then, I had seen a few people in my own family who had suffered from chronic kidney disease and they led a very miserable life on dialysis. And I was actually astonished to know that they were never offered the choice of transplantation all through their suffering. इससे हमें पता चलता है कि ट्रांसप्लांट के बारे में जो अवेयरनेस है, जानकारी है, वो ना सिर्फ लोगों में कम है, हो सकता है कि डॉक्टर्स में, फिजिशियन लेवल पर भी वो जानकारी कम है जो हम आम जनता तक नहीं पहुंचा पाते हैं। अब ट्रांसप्लांटेशन की अगर हम बात करें तो हम सभी जानते हैं ट्रांसप्लांट दो तरह से होता है। एक लाइव रिलेटेड रीनल ट्रांसप्लांट होता है और एक कैडेवरिक रीनल ट्रांसप्लांट होता है। कैडेवरिक रीनल ट्रांसप्लांट उन लोगों के लिए अच्छा ऑप्शन है जिनके पास घर में, रिलेटिव्स में, नियर रिलेटिव्स में कोई डोनर नहीं है, लेकिन डायलिसिस से बेहतर वगैरह रहता है कि अगर वो कैडेवर ट्रांसप्लांट करा ले। कई लोगों में ये एक मिथ रहता है, एक अवधारणा ऐसी बनी है कि कैडेवर ट्रांसप्लांट इज नॉट अ गुड ऑप्शन, but definitely there are so many examples that we have seen all through our careers that people who have got cadaver transplant done have had a better life as compared to those who have been dialysis who have been on dialysis all through their lives. तो मेरे पास में एक पीपीटी प्रेजेंटेशन भी है. इट इज वेरी शॉर्ट बट I'll try to take you through all the points and some statistics and data which we have. इंडिया में वैसे बहुत ज्यादा डेटा रीनल ट्रांसप्लांट और डायलिसिस को कंपेयर करने के लिए नहीं है, बट जितना भी हमारे पास में है वो यही बताता है. ग्लोबल डेटा से भी हमने एक्सट्रापोलेट किया है, तो हमने यही पाया है कि डायलिसिस और ट्रांसप्लांट की तुलना में जो लॉन्जिविटी या क्वालिटी ऑफ लाइफ पेशेंट को ट्रांसप्लांट के बाद मिलती है वो डेफिनेटली डायलिसिस के बाद में नहीं मिलती है. I'll start sharing my screen. Please let me
Yes,
know if it is visible.
yes, please, you can start.
Yeah. Is it visible?
No.
अभी भी विजिबल नहीं है क्या?
No, not yet. Uh,
Can WhatsApp to me or Ritika, anybody, we can share it.
you,
I'll send it to Sir Goyal sir.
yeah,
I'll
yeah,
send it
just
across to
send
him.
me. Yeah,
Yeah.
yeah.
I've sent it to you, sir.
Yeah.
तो जब तक ये ओपन हो रहा है, जो टेक्निकल ग्लिच है हमारा, हम लोग और चर्चा कर सकते हैं इस बारे में. तो मैंने कुछ एनेक्डोट्स भी इसमें डाले हैं, कुछ स्टोरीज जो हमने अपने नेफ्रोलॉजी के करियर में अभी तक देखी है. पेशेंट स्टोरीज में हर पेशेंट की एक अलग स्टोरी होती है. अगर मैं बात करूं एक ट्रांसप्लांट की जो मैंने बहुत रिसेंटली अभी किया है, फरवरी की ही बात है. ये एक 16 साल की लड़की है जिसका डायलिसिस शुरू हुआ था जब वो 14 वर्ष की थी. अब दुर्भाग्य ये है कि पिछले 2 सालों से वो डायलिसिस करा रही थी. उसे ट्रांसप्लांट के बारे में पता था भी, पर कभी किसी ने उस पर प्रेशराइज करके ये नहीं बताया कि ट्रांसप्लांट करके उसकी जिंदगी कैसे बदल सकती है. उसके अलावा जो हमारे समाज में एक बहुत ही बड़ी विडंबना है कि अगर हम बॉयज और गर्ल्स की तुलना करते हैं, लड़कों और लड़कियों की तुलना करते हैं, तो अगर किसी का फीमेल चाइल्ड होगा, बच्ची होगी, लड़की होगी, तो पेरेंट्स में भी एक अजीब सा एक बैरियर आ जाता है, मेंटल बैरियर. और वो उस बच्ची का ट्रांसप्लांट कराना उतना श्रेयस्कर नहीं समझते हैं, क्योंकि वहां पर फाइनेंशियल, सोशल और बहुत सारे स्टिग्मास हमारे देश में अटैच्ड हैं. बहुत ही जतन करके, बहुत ही प्रयास करके मैंने उस बच्ची के माता पिता को कन्विंस किया. हमने फाइनेंशियली उसको अलग अलग जरियों से, अलग अलग साधनों से एड या हेल्प दिलवाई, और उसके पश्चात वो लोग राजी हुए ट्रांसप्लांट कराने. और अब लगभग 3 महीने होने आए हैं उसके ट्रांसप्लांट को, एंड शी इज बिन डूइंग वेरी वेल. उसने बहुत हेल्दी वेट गेन किया है. रीनल फंक्शंस उसके एकदम नॉर्मल है. ईश्वर की कृपा से अभी तक उसे कोई ऑपर्चुनिस्टिक इन्फेक्शन भी नहीं हुआ है, एंड शी इज रियली हैप्पी. खुशी की बात यह है कि वो बच्ची अब इतनी आत्मनिर्भर भी हो गई है. पिछले 3 महीनों में ही जो उसने अपनी लाइफ में चेंज देखा है, वो ज्वेलरी मेकिंग का एक बिजनेस भी कर रही है. तो दैट शोज अस कि जो कॉन्फिडेंस या जो आत्मनिर्भरता उसको ट्रांसप्लांट के बाद में मिली है, वो डायलिसिस पर रहते, जो कि उसका शरीर भी दुर्बल रहता, उसे एक साइकोलॉजिकल भी लगता कि वो किसी प्रकार से अपनी जिंदगी की जंग हार रही है, तो वो इस मुकाम पर नहीं पहुंच पाती. स्लाइड्स आना स्टार्ट हो गई हैं, so I'll start off with that. So we are talking definitely today about dialysis versus kidney transplant, a nephrologist perspective. किडनी के फंक्शंस कई होते हैं, हम ये सब जानते हैं. मेन फंक्शन जो हमको पता है वो होता है ब्लड वॉल्यूम और फ्लूइड वॉल्यूम को, बैलेंस को मेंटेन करना. अगर एक्स्ट्रा फ्लूइड होता है तो किडनीज उसे यूरिन के फॉर्म में निकाल देती हैं, और अगर फ्लूइड की कमी होती है तो उसकी डिहाइड्रेशन की मार भी सबसे पहले किडनीज पर पड़ती है. इसके अलावा कुछ ऐसे तत्व होते हैं जैसे इलेक्ट्रोलाइट्स हैं, सोडियम, पोटेशियम, कैल्शियम, फास्फोरस, एवरीथिंग, इन सब का बैलेंस मेंटेन करना भी किडनी के प्रमुख कार्यों में से एक है। किडनीज ब्लड प्रेशर भी मेंटेन करती है। जब हम ब्लड प्रेशर का नाम सुनते हैं तो हमें लगता है कि ये हार्ट से संबंधित है। अब ये हार्ट से संबंधित भी हो सकता है, लेकिन ब्लड प्रेशर को रेगुलेट करने का जो मेन काम है वो अलग अलग हॉर्मोन्स और सब्सटेंसेस को बनाकर किडनीज करती है। तो ये उस प्रकार का हो जाता है जो मैं प्रायः अपने पेशेंट्स को भी बताती हूँ कि ब्लड प्रेशर और किडनी का इतना इंट्रिकेट रिलेशन है, जैसे मुर्गी पहले आई कि अंडा का सवाल हम आज तक नहीं दे पाए हैं। इसी तरह से ब्लड प्रेशर पहले हो के किडनीज खराब हुई है या किडनी की खराबी की वजह से किसी का ब्लड प्रेशर बढ़ा है, ये बहुत ही कठिन प्रश्न हो जाता है। उसके अलावा विटामिन डी का जो मेन प्रोडक्ट होता है वो बनाकर हड्डियों की मजबूती और इरिथ्रोपोइटिन नाम का सब्सटेंस बनाकर ब्लड को बनाने का काम भी किडनीज करती है। नेक्स्ट प्लीज। तो किडनीज फेल हो जाती है तो हम समझ सकते हैं क्या हो सकता है। हमारा फ्लूइड का बैलेंस, शरीर से गंदगी की सफाई, इलेक्ट्रोलाइट्स का बैलेंस, हॉर्मोन्स का बनना, विटामिन डी, इरिथ्रोपोइटिन, ये सब फेल हो जाता है। अब हमारे पास में दो ऐसी मोडालिटीज बचती हैं जो रेस्क्यू के लिए आती है। एक होती है डायलिसिस, एक होती है किडनी ट्रांसप्लांट। कुछ लोग डायलिसिस को चुनते हैं, कुछ सीधे ट्रांसप्लांट को चुनते हैं और कुछ डायलिसिस करवाने के कुछ समय के पश्चात ट्रांसप्लांटेशन पर आ जाते हैं। अब दोनों ही लाइफ की एक्सपेक्टेंसी बढ़ा सकते हैं, दोनों ही लाइफ को प्रोलॉन्ग कर सकते हैं, लेकिन ये एक बहुत ही शेयर्ड डिसीजन होता है जो हमें मरीज और उनके परिजनों के साथ मिलकर लेना पड़ता है। मरीज की शारीरिक स्थिति, आर्थिक स्थिति, मानसिक स्थिति सब देखते हुए उसके लिए कौन सा ऑप्शन ज्यादा बेहतर रहेगा। डायलिसिस के स्टैटिस्टिक्स या आंकड़ों की और सच्चाइयों की बात करें तो लगभग 2 लाख से ज्यादा भारतीय इस वक्त डायलिसिस पर हैं। और चौंकाने वाला तथ्य ये भी है कि हर साल लगभग 10 से 15% बढ़ोतरी होती जा रही है इस नंबर में। तो हम समझ सकते हैं कि आने वाले कुछ सालों में डायलिसिस के पेशेंट्स का बर्डन हमारे देश में कितना ज्यादा बढ़ जाएगा। 5 साल के सर्वाइवल की बात करें तो मान लीजिए अगर आज की तारीख में 100 पेशेंट्स डायलिसिस स्टार्ट करते हैं तो 5 साल बाद उनमें से 35 से 45 ही जीवित होंगे और डायलिसिस करवा रहे होंगे। बाकी पेशेंट्स की मृत्यु हो जाती है। इस बीच में किसी भी रीजन से, वो किडनी से रिलेटेड हो, हार्ट से रिलेटेड हो, बट वो 5 साल को इससे ज्यादा सर्वाइव नहीं कर पाते हैं। सोशल बर्डन तो ये डेफिनेटली होता है क्योंकि आप अपने कार्य से मिस रहते हैं, आपको छुट्टियां लेनी पड़ती है। 4 आवर्स आपको डायलिसिस में अगर बिताने हैं तो आप समझ सकते हैं कि हमारी जो वर्क फोर्स है, और खास तौर पे अगर ये युवा पेशेंट्स हैं जो हमारे लिए कंट्रीब्यूट कर सकते हैं देश और समाज की उन्नति के लिए, अगर उनके 4 प्रोडक्टिव आवर्स निकाल लिए जाए प्रति दिन, मतलब आप समझिए अगर हर व्यक्ति 3 बार भी डायलिसिस करवा रहा है तो पूरे हफ्ते में 12 घंटे उसने मिस कर दिए हैं। ट्रैवल की लिमिट रहती है हमारे देश में। हमने देखा है कि छोटे छोटे जो रूरल एरियाज हैं, कस्बे हैं, उनमें डायलिसिस की सुविधाएं नहीं रहती हैं, इसलिए उन्हें 100 से 150 किलोमीटर तक भी ट्रैवल कर कर डायलिसिस सेंटर तक पहुंचना पड़ता है। राइजिंग कॉस्ट तो अपने आप में एक चैलेंज रहा ही है और डायलिसिस से भी उससे अछूता नहीं है। तो क्या ट्रांसप्लांट एक बेटर लॉन्ग टर्म ऑप्शन है? डेफिनेटली। ग्लोबल और इंडियन डेटा डेटा जो कुछ इंस्टीट्यूट से हमें मिला है, जैसे सीएमसी वेल्लोर है, निजाम्स इंस्टीट्यूट है, एम्स दिल्ली है, वो ये बताता है कि अगर हम 5 साल के सर्वाइवल की ही बात करें और हेड ऑन कंपैरिजन करें डायलिसिस और ट्रांसप्लांट के बीच में, तो ये लगभग डबल का अंतर होता है। हमने देखा था वहाँ 35 to 40% सर्वाइवल रेट था, यहाँ 80 to 90% तक सर्वाइवल रेट हो जाता है। इसके अलावा जो हमने वर्क फोर्स के प्रोडक्टिव आवर्स के लॉस की बात की थी, वो भी यहाँ नहीं होता है। 3 से 6 महीने का थोड़ा सा ज्यादा सेंसिटिव टाइम रहता है डायलिसिस के बाद में, जब हमें ऑपर्चुनिस्टिक इन्फेक्शन से बचना होता है, जब हम ये तराजू में तोल रहे होते हैं कि इम्यूनोसप्रेसेंट मेडिकेशन ज्यादा देना है या कम करना है, इन्फेक्शन से बचाव ज्यादा जरूरी है या रिजेक्शन से बचाव ज्यादा जरूरी है। तो ये 3 से 6 महीने में ये सारी चीजें कवर हो जाती हैं और व्यक्ति एक बहुत ही नॉर्मल लाइफ जीना शुरू कर देता है। जैसा मैंने अभी टॉक के पहले ही बताया था कि 3 महीने में ही वो बच्ची ज्वेलरी मेकिंग का कोर्स करके मुझे इंस्टाग्राम पर अपने पेज को लाइक करने के लिए भी रिक्वेस्ट कर रही है, और वो मेरे लिए बहुत ही सुखद अनुभव था। डाइट पर जो रिस्ट्रिक्शंस होते हैं, नमक पर, पानी पर, नॉनवेज पर, ये सारे रिस्ट्रिक्शंस भी ट्रांसप्लांट के बाद में कम हो जाते हैं। व्यक्ति ट्रैवल कर सकता है, सोशलाइज कर सकता है और एक 100% ना भी कहूँ तो 99% नॉर्मल लाइफ जी सकता है। एक ही समस्या जो हमें ट्रांसप्लांट के बाद में आती है, जिसके लिए डॉक्टर्स को भी सजग रहना पड़ता है, मरीजों को भी कमिटेड और डेडिकेटेड रहना पड़ता है, वो है रेगुलर फॉलोअप्स और मेडिसिन। अगर हमारी इम्यूनोसप्रेसेंट मेडिकेशंस जिनके जरिए हम इम्यूनिटी को दबा के रखते हैं, अगर वो एक भी डोज मिस हो जाता है तो वो उस ग्राफ्ट किडनी के लिए और पेशेंट के लिए घातक हो सकता है। इसलिए मॉनिटरिंग और डिसिप्लिन इसमें बहुत आवश्यक होता है। तो ये ग्राफ भी हमें कमोवेश वही बता रहा है कि किस तरह से अगर हम ट्रांसप्लांट कराते हैं और किस तरह से अगर हम डायलिसिस पर ही चल रहे होते हैं, तो 5 साल बाद जो डिफरेंस देखने को मिलता है वो लगभग लगभग डबल का होता है। नेक्स्ट प्लीज।
Next.
कहानी ये बाबूलाल की है, परिवर्तित नाम है। बाबूलाल नाम के एक पेशेंट हमारे पास में आए थे, 47 साल के फार्मर हैं, कृषक है मध्य प्रदेश में। इनका डायलिसिस आज से लगभग 4 साल पहले शुरू हुआ था। इनके साथ सबसे बड़ी समस्या ये थी, जैसा मैंने बताया था, इनका जो नियरेस्ट सेंटर है, जो सबसे समीप उनके घर से सेंटर था, वो भी 40 किलोमीटर अवे था। हम समझ सकते हैं कि किसी भी व्यक्ति के लिए हफ्ते में 2 से 3 बार 40 किलोमीटर तक चल के जाना और आना, वो भी उस अवस्था में जब वो पूरी तरह से शारीरिक रूप से सक्षम नहीं है, उसके और उसके केयर गिवर्स, उसके परिवारजनों के लिए कितना कठिन और इस तरह विषम हो जाता होगा। क्योंकि हमने देखा है कि कई बार रोड्स अच्छी नहीं होती हैं, कई बार मरीजों के पास ट्रैवल करने के लिए उतना पैसा नहीं होता है, तो ट्रैवल कॉस्ट और फटीग इसको अनबेरेबल बना देती है। इन पर्टिकुलर महाशय को अपने जो लाइव स्टॉक हैं, जो जिसके जरिए वो जीवन यापन कर रहे थे, अपने गाय भैंस, अपनी खेती की छोटी सी जमीन, सभी को बेचना पड़ा अपने सेशंस भर को कंटिन्यू करने के लिए। वो अपने फैमिली इवेंट्स को मिस करते थे, वो तो अपने आप में एक समस्या थी ही। उनके जो शब्द थे, मैं यहाँ पे इंग्लिश में कोट कर रही हूँ, पर उन्होंने ये कहा था, जिंदा हूं लेकिन लाश की तरह हूँ। आई एम अलाइव बट अ लाइफ विच इज नो लॉन्गर माइन। दूसरी कहानी अनामिका की है, ये भी एक परिवर्तित नाम है। ये 29 ईयर्स की एक एचआर प्रोफेशनल है, दिल्ली की। यंग लड़की है, शादी नहीं हुई थी। आर्थिक रूप से ये लोग कुछ सक्षम थे। इन्हें समझाना भी मेरे लिए थोड़ा सा आसान था, क्योंकि एजुकेशनल बैकग्राउंड अच्छा था। उन्होंने मेरी बात को समझा, उन्होंने अपनी परिस्थिति को समझा, और सब आकलन करते हुए उन्होंने अपना ट्रांसप्लांट करवाया। उनकी माता जी ने उन्हें 2022 में किडनी दी, और 2 साल के अंदर ही वो अपने काम पर लौट आई। 2023 में ही उनकी शादी भी हो गई, और अभी इसी साल के 25 में उनकी एक सुंदर सी बेटी भी हुई है। तो शी हैज रिज्यूम्ड हर नॉर्मल लाइफ प्रोफेशनली एंड पर्सनली बोथ। उनका कहना है, पीपल लेस स्टेयर लेस एट माई स्कार्स नाउ एंड आई लिव लेस विथ फियर एंड मोर विथ होप। अब मैं ज्यादा आशावादी हो गई हूँ। अब मैं हर पल डर के साथ नहीं जीती हूँ कि किसी भी वक्त मेरे साथ कुछ भी हो सकता है। नेक्स्ट प्लीज। ये एक पिक्चर है जिसमें मैंने आइडेंटिटी छुपाई है मेरी ट्रांसप्लांट की पेशेंट, जिनके बारे में मैं आपको अभी बता रही थी। 3 महीने पहले जिस बच्ची का ट्रांसप्लांट हुआ है, उनके आजू बाजू जो खड़े हैं वो उनके माता पिता हैं। माता जी ने किडनी डोनेट की है। यहाँ पे अगर आपने कॉमन फैक्टर देखा हो, तो अनामिका के केस में भी माता जी ने ही किडनी दी है, इस बच्ची के केस में भी माता जी ने ही किडनी दी है। तो ये भी एक हमारे साथ में एक सामाजिक जो हमारी संरचना है, और जो हमारी सोच है, उसको दर्शाता है कि ज्यादातर केसेस में फीमेल ही डोनर होती है। और अगर हम फिर से आंकड़ों की बात करें, तो 75% केसेस में डोनर्स आर फीमेल। मतलब चांसेस ऑफ अ फीमेल डोनेटिंग kidneys to her near and dear ones, be it her spouse, be it her children, be it her any other relative, is at least 3 times higher than that of a male. अब ट्रांसप्लांट कराने में चैलेंजेस क्या आते हैं? डोनर शॉर्टेज सबसे बड़ा। डोनर के लिए हमें देखना पड़ता है कि या तो फैमिली का जो कोई नियर वन है, जैसा नोटो की गाइडलाइंस में दिया है कि दादा दादी नाना नानी अगर वो शारीरिक रूप से योग्य हैं, बच्चे अगर वो बालिग हैं, आपके पत्नी या आपका पति, और आपके माता पिता, आपके भाई बहन, ये लोग होते हैं जो नोटों में बताए गए हैं कि ये किडनीज डोनेट कर देते हैं। कुछ स्पेशल केसेस में इमोशनली रिलेटेड जो मेंबर्स होते हैं, जैसे अंकल आंट्स हुए, और मदर इन लॉ हुई, फादर इन लॉ हुई, वो प्रॉपर जस्टिफिकेशन और लीगल ऑथराइजेशन के बाद में वो भी किडनीज डोनेट कर देते हैं। लेकिन हमने देखा है कि अभी हमारे यहाँ न्यूक्लियर फैमिलीज का ट्रेंड ज्यादा बढ़ गया है। भाई बहनों का डोनेशन तो मैं बहुत ही कम देख रही हूँ आपस में। या तो स्पाउस, बीवी या पति ही करते हैं, या फिर पेरेंट्स करते हैं, और उनमें भी माएँ करती हैं। अगर वो ऑप्शन नहीं बच रहा है, तो कैडेवर का भी एक ऑप्शन होता है, जिसमें कि प्रॉपर तरीके से आपका रजिस्ट्रेशन किया जाता है, और आपके ब्लड ग्रुप के किसी व्यक्ति की अगर ब्रेन डेथ हो जाती है और वो डोनेट कर रहे होते हैं, आपका उस रजिस्ट्री में नाम ऊपर आता है तो आपको बुला लिया जाता है। उसके अलावा जो चैलेंज होता है वो होता है सर्जरी से डर। सर्जरी के नाम से जो एक डर समाज में बैठा है, वो भी मुझे प्रैक्टिकली बहुत ज्यादा देखने को मिलता है। मैं अगर कई बार डायलिसिस यूनिट्स में जाती हूँ, वहाँ यंग पेशेंट्स को खास तौर पर काउंसिल करती हूँ कि उन्हें ट्रांसप्लांट कराना चाहिए, तो उनका ये जवाब आता है, अरे नहीं नहीं, हमें सर्जरी से डर लगता है, हम तो डायलिसिस पर ही ठीक है। और वो इतना गहरा पेट कर जाती है ये सोच कि उसको बाहर निकालना भी बहुत मुश्किल होता है। तो अगर हम ऐसे कोई पॉजिटिव एग्जाम्पल्स उनको देते रहेंगे तो शायद वो पॉजिटिवली मोटिवेट होंगे। डोनेशन के बारे में जो कुछ मिथ्स हैं या गलत अवधारणाएं हैं, वो भी इस चीज को रोकती हैं। जैसे कि लाइव डोनर को ये लगता है कि डोनेशन के बाद में वो बीमार हो सकता है, अगर उसकी दूसरी किडनी खराब हो गई तो उसका क्या होगा। वो ये बात नहीं समझ पाते हैं कि एक गिट किडनी पर भी उसी तरह एक बहुत ही सामान्य जीवन यापन किया जा सकता है जैसा कि दो पर किया जाता है। कई लोग पैदा ही एक किडनी के साथ होते हैं, उन्हें आजीवन ये पता ही नहीं चलता है, एंड दे लिव अ वेरी नॉर्मल लाइफ। उसके अलावा जो कैडेवर डोनेशन में एक सोशल स्टिग्मा है कि कुछ धर्मों में या कुछ सेक्ट्स में इस तरह से बोला जाता है कि अगर आपके शरीर की चीर फाड़ कर दी, उसमें से ऑर्गन्स निकाल लिए, तो शायद आपको मोक्ष प्राप्ति ना हो। ये भी एक बहुत ही बड़ा चैलेंज है जो कई बार हमें पेशेंट्स के अटेंडेंट्स को काउंसिल करने में फेस करना पड़ता है। फैमिली डायनामिक्स की हम चर्चा कर चुके हैं। जेंडर इक्वालिटी हमने देखा है कि लाइव डोनेशन के केस में जेंडर मोस्टली डोनर का फीमेल होता है, और रेसिपिएंट्स के केस में जेंडर मोस्टली मेल्स होता है। फीमेल्स को किडनी मिलने में बहुत समस्या होती है। एक उदाहरण मैंने आपको पॉजिटिव अभी 16 साल की लड़की का दिया है, एक और 12 साल की बच्ची भी मेरे पास में आई थी। उसके माता पिता दोनों का ही ब्लड ग्रुप ओ पॉजिटिव है, बच्ची का भी ओ पॉजिटिव है, एंड दे आर बोथ यंग एंड फिट। लेकिन क्योंकि उनकी तीन लड़कियां और हैं और एक छोटा बेटा है, उन्हें उस बच्ची को किडनी नहीं देना है। आप सोच सकते हैं कि यही चीज अगर ईश्वर ना करे उस बेटे के साथ या बच्चे के साथ हुई होती, तो माता पिता दोनों में कंपटीशन चल रही होती कि मैं किडनी दूं या तुम दोगी। तो वो सारी चीजों का सामना करना, मैंने उन्हें आधा घंटा समझाया, लेकिन मुझे ये लगा कि वो पूरा ही प्रयास मेरा लिटरली वेस्ट हो गया। तो ये सभी हमें ओपीडीज में बहुत ही कॉमनली देखने को मिलता है। कॉस्ट और एक्सेस जो होता है ट्रांसप्लांट सेंटर्स में, ये भी एक चैलेंज है। अर्बन एरियाज में रहने वाले लोग जो टाइम पर रेफर हो जाते हैं, वो लोग ट्रांसप्लांट करवा पाते हैं, बट कई बार लोग या तो रेफर नहीं होते हैं, उन्हें पता नहीं चलता है कि ट्रांसप्लांट बहुत अच्छा ऑप्शन है। अड़ोसी पड़ोसी से सुने हुए अगर कोई बुरे किस्से होते हैं ट्रांसप्लांट के बारे में, तो वो उसी को आत्मसात कर लेते हैं और उसे तथ्य मान लेते हैं। उसके अलावा जो लाइफ लॉन्ग मेडिकेशन फॉलोअप है, ये भी अपने आप में एक चैलेंज है। नेक्स्ट प्लीज। कुछ पेशेंट्स के लिए ये माना जाता है कि डायलिसिस ज्यादा बेहतर ऑप्शन है, खास तौर पे जिनकी उम्र ज्यादा हो गई है, और उम्र ज्यादा के अलावा जो क्रोनोलॉजिकली एज तो कर गए हैं, वो फिजिकली भी एज कर गए हैं, वो फ्रेल हैं, वो कमजोर हैं, उन्हें दूसरी कोमॉर्बिडिटीज हैं, और हमें लगता है कि हम डायलिसिस ट्रांसप्लांट करके उन्हें इम्यूनोसप्रेशन देके डायलिसिस से बदतर हालत में ले जाएंगे, तो उन लोगों को हम ये सलाह कभी भी नहीं देते हैं। कई बार जब डोनर अवेलेबल ही नहीं हो, कैडेवर में भी लिस्ट में बहुत बाद में नाम आ रहा हो, ऐसे में डायलिसिस डेफिनेटली ब्रिजिंग का काम करता ही है। अनकंट्रोल्ड इन्फेक्शंस या कुछ ऐसे कैंसर्स होते हैं जो मेटास्टेसाइज कर रहे होते हैं, उनमें भी हम ट्रांसप्लांट को नहीं कंसिडर करते हैं। उन लोगों में डायलिसिस फिर भी एक बहुत अच्छा विकल्प है, क्योंकि ये 5 से 10 साल तक की जीवन अवधि तो डेफिनेटली बढ़ा ही देता है। तो क्या चुने? ट्रांसप्लांट डेफिनेटली बेटर क्वालिटी और लेंथ ऑफ लाइफ देता है। गुणवत्ता और अवधि दोनों ही ट्रांसप्लांट के साथ बढ़ती है, ये हमने अभी पिछले स्टैटिस्टिक्स में भी देखा है। लेकिन डायलिसिस इज एसेंशियल व्हेन ट्रांसप्लांट इज नॉट feasible. We need to talk early with a nephrologist and plan ahead both medically, physically, emotionally, socially and financially. The message of hope is both options save life. Early action matters. ऐसा हम लोगों में काफी बार चर्चा में ये बात निकलती है कि भगवान करे कभी कोई बीमार नहीं हो, लेकिन अगर आपको भगवान ने बोल ही दिया कि ये अल्टीमेटम है कि कोई आपको एक अंग चुनना पड़ेगा जो क्रॉनिकली खराब हो, तो उसमें किडनी का चयन करना चाहिए, क्योंकि हमारे पास में डायलिसिस और ट्रांसप्लांट जैसी सुविधाएं उपलब्ध है। हार्ट का ट्रांसप्लांट भी होता है, लिवर का ट्रांसप्लांट भी होता है, बट वो इतना सरल और सुगम नहीं होता है जितना कि किडनी का होता है, नंबर वन। नंबर टू, डायलिसिस जैसी सुविधा जो ब्रिज का काम करती है, वो इन अंगों के फेल होने में उपलब्ध अभी भी नहीं है। Consider becoming an organ donor definitely, and support someone you know with kidney failure. Awareness of both doctors and patients and caregivers and general public is the first step towards change. Thank you.
Thank you very much, Dr. Tiwari, for giving such a elaborate presentation. I know that you have just attended a patient in the hospital and you are sitting in the car and doing it. It shows your dedication, how dedicated. And I found that you're very much passionate about the kidney transplant as well as for the women empowerment. Although I am very sorry to say that today I read a news of Indore only, from where you are right now, that a 3-year-old girl who was suffering from brain tumor was advised by a Jain monk, because the parents were Jain, to kill her. And the parents killed her. And no action has been taken. This is not allowed legally, ethically in India, which is very, very wrong, although it is out of context. But when you have said so many things about the women and the child, girl child, so I wanted to mention this. Now, you are mentioning about the dialysis. Our topic is dialysis versus kidney transplantation. The problem today in India is that every NGO, even the government, promotes dialysis centers. And although I'm talking on the platform of Rotary Club of Organ Donation International, which is a part of Rotary International, even the Rotary International or the Rotary clubs or the Rotary districts also promotes dialysis center without understanding that it is fine, but don't promote to those centers which are already having transplant facilities like metros. We are opening new and new dialysis center. Why? Why not we are opening the dialysis centers in those cities or the districts where there is no transplant facility, and try not to encourage more dialysis center. So in other words, I may say that we will be encouraging more transplant. What you say about this, Dr. Tiwari?
You're absolutely right, sir. डायलिसिस वहां पर ऑफर होना चाहिए जहां पर कुछ भी नहीं है, जहां मैंने जैसे बताया है लोगों को 40, 50, 100, 150 किलोमीटर तक भी जाके डायलिसिस करवाना पड़ रहा है, और वो उन्हें हतोत्साहित करता है। वो लोग 1 महीने, 2 महीने, 6 महीने ये करते हैं। जब वो उन्हें बहुत ज्यादा चैलेंजिंग लगने लगता है, तब वो भी छोड़ देते हैं कि ठीक है, यही इस मरीज का फेट है, यही इसकी किस्मत है, तो हम कुछ भी नहीं करवाएंगे। उससे अच्छा है कि हम डायलिसिस सेंटर्स वहां प्रमोट करें जहां एक्चुअली कुछ भी नहीं है, जहां मूलभूत सुविधाओं की ही कमी है। उसके बाद में हमें जो ब्रिज का टाइम हमने जैसे चर्चा की है मिल रहा है, उस बीच में हम जाकर रूरल एरियाज में लोगों को अवेयर करें कि ट्रांसप्लांट भी एक ऑप्शन है, फाइनेंशियली भी आजकल वो फीजिबल हो गया है। कुछ जगहों पर सरकारी हॉस्पिटल्स में खास तौर पर ये आयुष्मान में भी कवर हो रहा है, तो एटलीस्ट वो वहां जाकर अपना ट्रांसप्लांट करा सकें। कम से कम वो जिएंगे, तो कम से कम वो होपफुल तो रहेंगे कि उन्हें एक ऐसा स्थान मिल रहा है, उनके घर के पास में ही मिल रहा है, जो वो जाके डायलिसिस कर सकते हैं।
You are absolutely right. And I would like to just give one brief thing, as you mentioned about the Ayushman Bharat. The kidney transplantation package has been included under PMJAY scheme of Ayushman Bharat by the Ministry of Health and Family Welfare. Also under Rashtriya Aryog Nidhi, RAN, financial support up to rupees 15 lakh is provided by the Ministry of the Patients, by the ministry to the patient who are below poverty line for transplantation of heart, lung, liver, kidney, etc. I'm sure, Dr. Tiwari, are you aware about this or not?
Absolutely, sir. जब
yes. So 15 lakhs.
पहले हमने आयुष्मान के अंतर्गत भी सुपर स्पेशलिटी सरकारी अस्पताल में ट्रांसप्लांट किए हैं।
So now you can understand up to 15 lakhs. So basically the poor patients who are suffering from kidney disease can be transplanted, because 15 lakhs is a good amount. Even in a private hospital like Jaslok and other in Mumbai, they are charging between 7 to 10 lakhs of rupees, including, I think, the liver can also be transplanted. Heart is a bit more. Anyway, so thank you very much for giving my replies. Now I'm opening to my fellow members, and I would like to introduce my first question. The question I want that he should give, because our one of the member is a Rotarian, Nitin Gupta. He suffered from the kidney failure, and he's from right now he lives in USA, and he was on dialysis for 5 years. Every night he undergoes for the dialysis, and approximately 5 years. I think he will tell you more. And after that, he got a brain dead kidney patient's kidney, and he was transplanted last year only on, I think, in 2023 December. So Rotarian Nitin Gupta, are you there? Please ask your question and give your views about how you suffered, and what are your views about kidney versus kidney transplantation versus dialysis. Rotarian Nitin Gupta, please.
Yes. Hi. Hello.
Yes. Is it possible to start your video, if possible?
Let me see.
Yes. Okay. You can go ahead.
Yeah. So thank you, Dr. Isha, so far.
Your
Hello,
phone is
Nitinji.
Nitinji, your phone is on mute. And Rotarian Nitin Gupta originally belongs to Indore only, Dr.
Oh, is
Tiwari.
it?
Yes.
Okay.
Yeah.
Yes, Rotarian Nitin Gupta. Please go ahead.
Yeah. Hi, doctor. One thing you have not covered, I believe, is not too prominent in India or Indore so far, is the peritoneal dialysis.
Peritoneal.
So,
I deliberately did not, because it is absolutely, literally not practiced in this part of the country.
yeah. So I basically, for me, my case, I was lucky to have been a candidate for parental dialysis, and basically when they compare, they do say parental dialysis gives a better lifestyle for the patients who are going on dialysis. So for me, basically, I continued on my job all along these 4 5 years of dialysis,
Mm-hmm.
and I would have the cycle done,
At the
log
night
into the
time.
machine at home in the evening, and throughout the night the cycle would go. And yes, in the morning, as you rightly said, for the dialysis patients, there is the life is very uh, much restricted because of the movements. Like it, you have to be restricted to home, you have to be put on the machine at a specific time because the cycle time would take for dialysis. And then in the morning you do feel a little nauseated and weak and all. So then the recovery time after the dialysis still is about 2 3 hours, and then you could head to the work. But luckily I continued throughout my dialysis cycle to be on job uh, front. So one was that, and basically that's a very very better way. And on the cost comparison also, the data shows that the peritoneal dialysis is cheaper than the hemodialysis for the patient, and in terms of the longevity and the restrictions are less for the person who is on the peritoneal dialysis. So maybe that one, I don't know why it is not getting the attention in India, because basically the dialytic solution is just sucrose, and I believe India has got a lot of manufacturing can be done cheaply on all those solutions.
What you say
See,
about this,
the
doctor?
main reason which we had been trying to introspect into, like, what is the thing which is holding people from being put on peritoneal dialysis. So down south, when I was getting trained at Nizam's Institute of Medical Sciences, Hyderabad, we had almost a ratio of, I would say, if not more than at least 60-40 for hemodialysis versus peritoneal dialysis. But whatever we had seen was that people here in India have a very rigid mindset. It becomes very difficult for them to understand the hygiene issues, how to take care of the catheter. They used to come with a lot of infections in the
Yeah,
peritoneal catheter, and it required ultimate removal. There used to
yeah,
be resistant and horrible kind of fungal infections, and those were the things which actually puts off a physician in a private practice, probably, that they would suggest peritoneal dialysis to somebody. Other than
Okay.
that, since hemodialysis has been subsidized, there are many schemes, there are organizations, there are NGOs which have been coming up with dialysis centers which are approachable. So one thing is awareness, second is compliance and adherence to a doctor's instruction, and the third, of course, is I would say the opening up of the hemodialysis center more commonly than somebody getting to know about peritoneal dialysis itself.
Right.
So according to you,
Understand.
Dr. Tiwari, in India, the problem is, one is the hygiene condition. Secondly, what Rotarian Nitin Gupta says, because the dialysis has to be done at home, it means for 3 or 5 years till the dialysis, you cannot go in the evening. While in India, this is not possible. We see even everyone has to go to attend marriages, birthday parties, conferences, dinners. So it is not possible in India, Rotarian Nitin
No,
Gupta.
what I believe Nitinji must have been undergoing must have been a machine-based automated peritoneal dialysis, which is APD machine, the cycler machine, which you must have been using. There is another technique in which manual PDs are done, where manual exchanges are done, and it stays there for 8 hours. You're free to roam for around 8 hours. Then 1 hour it takes to exchange it, and then the next 8 hours again you are free to roam around. So that is another thing, but it is very technique based, and people learning it and performing it rightly with all aseptic precautions and hygiene measures, it is very difficult in our country.
Yeah, you're right. Like with this peritonitis does take place in case your catheter is not cleaned up and all. So precautions have to be taken throughout each
Right.
cycle of engaging and disengaging the catheter from the unit. And
Counseling a patient for coming and passively lying near the hemodialysis machine regularly itself is a challenge. Imagine, teaching them the technique and expecting them to perform it regularly at their home is like a bigger challenge here. So that's why I think nobody wants to take that kind of pressure on their heads when it comes to nephrologists and physicians. That's why they seldom advise it here in Madhya Pradesh and the surrounding areas.
Okay. Thank you very much, Rotary and Nitin Gupta. Now, I would like to take the question or the experience of another our Rotarian member. He is also based in USA. He also got the transplant, but his kidney was donated by his wife. He is Rotarian Sunil Gupta. Rotarian Sunil Gupta, are you there? If you are there, please unmute yourself and give your views about the dialysis versus kidney transplantation.
Yes, good morning. Can you hear me? I apologize. I joined a little late.
No, we can hear you clearly.
Yes, I caught the last part of the discussion. Dr. Tiwari, really appreciate your enlightening us and talking about this important subject. I've seen, I was very fortunate that I got preempted and I did not have to go on dialysis. But I do have friends. I'm one of the advocates for kidney transplantation at Stanford. My wife is also an advocate for California. We do talk to a lot of people. There is a lot of awareness that is needed. Dialysis is not a lifestyle. It prolongs your life, and most people just do not understand that. I was going to actually talk about the question of what I have noticed in the United States versus, call it the West versus what I notice of attitudes in India is here, the physicians don't really take responsibility of your health. It's up to you as a patient, right? So even though I've heard a Rotarian Nitin Gupta talk about peritoneal dialysis, it was up to him to be responsible for the cleanliness and his own health basically. And the attitudes I've seen overseas with my friends in India, they really put it on the doctor to take care of their health. Do you find that to be the case, Dr. Tiwari?
Oh, that's a very precise I would say, statement. It's very up to the point that people here, they are in a passive kind of a mode. Like, they put everything on the physician's shoulder, and they literally would be holding everything, like for everything which is going on with them, the physician or the doctor who's treating them is responsible. They don't understand the importance of educating themselves and trying to, inculcate that kind of behavior, which would basically be, uh, you know, uh, improving their own health, their own lifestyle, their own quality of life. And the dependence on physicians and doctors is much more as compared to that which is seen in the western part of the globe.
Okay. Okay. Thank you very much, Rotarian Sunil Gupta. Now, I would like to see if, Rotarian PHF Dr. Rohan S. Monis, you are there. I would like to take his views and his questions, because he is an administrator of a very reputed medical college in Mangalore, and he is they have the dialysis center, but till now they have not yet started the transplant center. Although everything is ready, they are just waiting for the permission. Your views and your question, Dr. Monis, please.
Yeah. Thank you, Dr. Tiwari, for the talk. It was beautiful and very explicit. I mean, being a medical person, we understand the flow and the anguishes that we doctors undertake, in the critical care program. I mean, in the critical nephrology program. In my experience, I am pro-transplant, honestly. I mean, yes, we run dialysis units primarily because emergency. We constantly fight with the patients because one beautiful thing I like about your profile is preventive nephrology. We talk, or we try to advocate a lot of these people to look after yourselves. We have people with diabetic symptoms and blood sugars 350, 400, और उनका कहना है कि डॉक्टर साहब कोई नहीं, अभी तक ठीक है ना. I mean, sir, अभी तुम, I said, we tell him, you're just 35 years old. तुम 10 साल में मरने वाले हो अगर तुम ऐसे ही चलाओगे. But उनको फर्क ही नहीं पड़ता. This is how health is the last of the priority list for them. Very sad. This is one we've seen. And the other factor is, yes, the number of people wanting to go for a transplant is less. Recently, we had a child. She just finished a grade 12, was getting into a college level, and she got some sort of a crazy viral infection which knocked off her kidneys. And now she has to be on dialysis. And she had 2-3 nephrology consultations, and then she came to us because we are highly subsidized in dialysis. The doctor was priming them for a transplant. Now, what happened was the father and the mother got us over here. And the nephrologist, obviously, when we're preparing for a transplant, we need a new, we don't recycle the tubes. We have to put a new tube for every cycle. I sat with the father and tried to speak to him, saying that, have you thought about transplant? He didn't know much. I spoke to him, convinced him, and he said, okay, I will talk to her mother. So I said, even you are there. Why don't you take a chance? He's like, I will talk to her mother. So the mother was spoken to, and mother was ready to give a kidney. And when all the evaluations happened, she had microalbuminuria happening, proteinuria in the urine. She was passing protein in the urine. She was also an early diabetic. The chances of her to donate a kidney is 0 right now. It comes back to the onus of, comes back to the father. He just refused. No, because they have these mindsets about, potency and, their way of life. I'm an earning member of the family. I sat with them for about at least half an hour with the daughter, saying nothing will happen to you. It's beautiful what is going to happen. And long term, if you talk about the evaluations of the cost benefit analysis, transplant is any day cheaper than doing a long term dialysis. But they refused. They just refuse. So this is the challenge which we face in many of the people right now. But on the other contrary, I mean, we have, she is also a member on the group. She hasn't joined us today. We have Mrs. Dakshani. She is one of the account superintendents with us at the hospital. She is a kidney donor to her brother's wife. Now, this is a very unusual case wherein they had to, she was checked, evaluated, she got the approval. The catch was here because she had to donate to the brother's wife. So it went through close to a 9-month routine with the NGOs and the lawyers and the paperwork and all. It was very harrowing. 2-3 trips to Bangalore from Bangalore. And finally it was done. She's doing well. The recipient also doing very, very well. And these have been a couple of experiences. I mean, but I think transplant is the way forward. We have to talk.
Right. We have an example of sister-in-law donating here from whatever you have told, sir. And another example which I'm reminded of, like we are planning his surgery the next month actually. So I'm reminded of this case.
Right.
The family dynamics, as I had mentioned, it makes a lot of difference because we have a patient who's a 38-year-old male with an 8-year-old girl, and it's a nuclear family again because he had lost his parents very early when he was somewhere around 2.5, and his sister was somewhere around 6 years old. That's what they've told me. And now the sister has been married off. She has 2 kids. She has a family to look after, and both their blood groups match, the
Oh.
patient and the sister. But because the sister has been married off and the husband doesn't want her to donate her kidney, she blatantly refused that, I just can't do it. I have my own issues. I have my own family. I won't be doing it. And now who's donating? The wife. But the problem is that their blood groups don't match. So again, it will be very difficult for them because cost-wise, it becomes almost double the cost of going for a ABO compatible versus ABO incompatible transplant. But at least they are counseled about it, they are convinced about it, and they are very motivated about going for transplant. So we'll be carrying out that ABO incompatible transplant the next month. So these are the things we, commonly keep facing because of all the social things which happen around, and people they literally fail to understand that after donating kidneys, their life won't change, and in fact, they are literally adding to the years of the life of their near and dear ones, which they should, if at all, they have that chance.
Okay, thank you very much, Rotarian Dr. Moniz. Now, Dr. Tiwari, when you are mentioning about that matching of wife and husband, why you have not tried the swap donation in
No, we
Indore?
have very, very legit question, sir. We have been trying to do it, but unfortunately, most of the times, when we have some incompatibility, the recipient is O positive or O negative for that matter, and the donors are of various blood groups, right, from AB, anything. So what happens usually is that when we try to swap this kind of pair with somebody else, we need a donor who is O and a recipient who is A, for example. So the donor who's O will not give his or her kidney to somebody else. Rather, they'll prefer giving the kidney to their own person because O can donate it to everybody. So that's one funny
But
paradox
we
we come
can
across.
but we can have chain system because one of our member from USA he got the kidney after the 6 cycles and the kidney flown from San Francisco to New York and from New York to different places, and then they got it. So if we will start the chain system
Yes,
in India.
it is very common in the West, and they have literature about it. And it is basically called domino effect because there is some altruistic donor, one donor who doesn't have any recipient in his or own family, and he's donating or she's donating out of free will. That person will initiate the chain, and like the domino effect of playing cards, it just goes on, and you keep on donating and create a chain to, people who don't have that particular blood group person in their families. So this domino effect thing is still not common in our country. In fact, two-pair swap is also not that common. We tried for this kind of a pair A and B, but we couldn't find. So the last resort was definitely ABO incompatible. And luckily, with all the advancements in the treatment and the plasmapheresis and other things, we have been performing ABO incompatible, and the results have been kind of at par with ABO compatible also.
Okay, thank you very much. Now I would like to take the opinion and the suggestion or the question from our Rotarian PHF, Ritika Gupta. She is the CEO of a private hospital and which is having the Rotary Dialysis Center in that. And the interesting part is they organized a program on organ donation, and I purposely asked them to invite all the dialysis patients and their relatives to attend that program. And at that time, about 100 patients were undergoing dialysis. And you will be shocked to know that not a single person, either for the patient or the relatives, attended the organ donation awareness program. It shows the mentality or the conditions of in India. And when we are talking about dialysis versus kidney transplantation, these are conditions. Rotarian Ritika Gupta, your views and your question, please.
Thank you very much, Mr. Goel. Also, thank you very much, Dr. Isha. That was a brilliant presentation, and we got to know so much about the psyche of a patient and their attenders who come. And I also happen to, have had interactions with so many patients that visit our premises. And there was one such case wherein there was a middle-aged man of say 56 years. The wife was his attender, and they said that they had already underwent the transplant. I mean, it just so happened that I spoke about transplant to them, that they never considered it. But the lady said they already went through a transplant just pre-COVID, but it's just that it couldn't sustain for too long, and they did not have the means to support another transplant. And they did not have any aid from the government. They did not have any Ayushman cards with them to support. And also, their age was 56 years, which is why they couldn't have gone for any other means. So, I wanted to understand from you, is it a very common practice, or what are the percentage occurrences when transplant does not really last? And how many times can a person actually undergo transplant again and again?
Right. So, very good question, Ritika ji. Basically, as we have discussed the statistics, 5 year survival rate is something we talk about. Like what happens to people after 5 years of undergoing a transplant? It has been seen that 80 to 90% is the survival rate. In between, there are patients who have had graft loss, but that percentage is somewhere around 15 to 20. So it's a very meager number if we compare with those who have been having a thriving graft or a thriving transplant even after 5 years of their transplant. So it's a very small number. And since, like from what I could gather from your example, this person definitely, unfortunately, must have suffered from lack of procurement of his drugs and immunosuppressants owing to the COVID thing which had occurred in between. There were many patients who had lost their grafts. There were many patients from dialysis who had lost their lives during that phase. So, because of the lockdowns and the restrictions, and also immunomodulation which had occurred in these patients, because if they contracted COVID, they either suffered from graft loss or we suffered the patient loss in that form. So, that thing definitely must have occurred with him. He must not have had his medicines. He must have missed, even if a single dose he must have missed, he would have lost his graft. So that would have happened. But yes, there are patients who undergo multiple transplants also, and it performs well. We just have to go for PRAs or a panel reactive antigen test before we perform a second transplant to predict to a very large extent as to how long would this particular second graft survive. If the PRAs are very high, we first prepare a patient with low PRA. If they are low, then we straight away go ahead with another transplant as well. And we have seen such cases also. In fact, there's one patient in our own dialysis center where he was transplanted when he was 25 years of age. The kidney was given by mother. Then he was transplanted at 37 years of age when the first graft failed after some odd 12 years. And this time the sister had given the kidney. And now he's somewhere around 50 years old, and he's actually willing for a cadaver registration to undergo a third transplant. So these 12 plus 13, I would say 25 years, he had done beautifully on transplant. And imagine if he had simply said no to transplant, he had denied that option, and he was only on dialysis, he won't have lived for these past 25 years, which he had in this case. So yes, it is common. Many patients go for multiple transplants, and most of the times they do well.
Okay,
Thank
thank you
you.
very
Thank you
much.
very much,
Another
Dr.
question I had, there are so many patients these days who are young. Is there any particular reason that we can cite for young occurrences of kidney diseases in young patients?
Right. So, see, there is one entity which is known as CKDU. That is CKD of unknown origin. So, with the time and advent of new technologies and awareness, people going and getting themselves checked, evaluated is also increasing. So the screening part has definitely increased. It is still having a lot of, gap, but it has increased, and that's why we have higher numbers. So people might have been suffering and dying from kidney diseases even before, but due to the increasing awareness, the numbers have automatically increased. Number one. Number two, definitely lifestyle, and the way people have been eating, the way people have not been exercising, it has led to development of these kind of chronic diseases like diabetes, hypertension, and these two diseases have been the biggest nemesis of kidneys. So yes, CKD increases with the increase in prevalence of these diseases. Apart from that, there are some things in soil, be it pesticides, be it, herbicides, insecticides, and the kind of fertilizers being used, the quality of water, that has also been altered. And with heavy metals usage, young patients have been coming up with kidney diseases, and nobody knows the cause. They come up to us straight away when the kidneys have stopped functioning, and we don't know what like the cause has been unless we biopsy them and try to find silica particles in the kidneys. Never, you never come to know about it. So that again has been contributing to the increasing numbers.
Thank you
Okay,
very much.
thank you very much, Rotarian Ritika Gupta. We have with us Rotarian Dr. Rajeshwari Devi. Dr. Rajeshwari Devi is the former health secretary in the government of Karnataka. Dr. Rajeshwari Devi, if you can unmute and you can give your opinion and ask the question. But before that, I will just tell what Rotarian Ritika Gupta has just asked about the young youth, etc. There is a report published about 2-3 months back that 20% of the IT professionals in Karnataka, that is mainly the Bangalore, are suffering from the organ or mainly the kidney failure because of, I think, the lifestyle, as you rightly said. This is a very alarming thing, doctor. I am sure that the youth, the parents should learn, they should understand that they must keep their children, as well as even the children should understand that they must keep their lifestyle healthy so that they should not suffer. Yes, Dr. Rajeshwari Devi, please. Dr. Rajeshwari Devi, please unmute, and you are already unmute. You just switch on your video and you please give your views about this dialysis versus kidney transplantation.
I'm very sorry that is where there is no proper internet.
Yes.
Staying near Satya Sai, which is, I think you know about it. There is no good internet here, but
No,
still
right now
I'm
we
able
can,
to.
yes, we can hear you. Yeah, you can
Yes,
do like
yes.
this only. Yes,
Yeah,
please.
yes. Today's youth, whether it is ITBT or medical students or the people who are in so many areas, the lifestyle is becoming more towards a lot of stress, a lot of working pressure, the difficulties in adjustments, difficulty in social kind of a life where there are so many things happening with these youngsters. Their way of life, the food habits, the drinking habits, the usage of lot of soft drinks, the usage of these added things that help to go habit any hindrance is making their what you said kidney health.
Dr. Rajeshwari Devi, we can't hear you properly because of, I think, as you mentioned, the internet problem. So thank you very much for giving your views. Yes, this is one of the main problem. Dr. Tiwari, the time is going up. I am sure that, but there are many others who wants to ask the question. My only one question to you is, don't you think in India, the quackery, I am using the word, those who are not having full knowledge of the pharmacology, they are giving such types of medicines they are prescribing which are harming the kidney. Do you think this is one of the main reason of the kidney failure in India?
Oh, definitely, yes. It anguishes me when I see people coming up with kidney diseases, and when they're probed through like what medications they used to take. So one thing which commonly comes up is the rampant usage of over-the-counter medications which they have been taking, considering pantoprazole and other drugs as gas busters, and they have been taking it for years together. Apart from that, the painkillers like ibuprofen, diclofenac, they just pop it like chocolates, and every day they used to take it for even the slightest of pains they used to have in the bodies. Apart from that, it literally angers me and frustrates me when I see them coming up with various kind of pudiyas, and they'll just open it and they tell that this was given by a certain doctor, the supposed doctor who's actually not a doctor, and they have been taking it for months together for ailments like body pains and jaundice and so many other things, like so people who have been having rheumatoid disorders, rather than going to a rheumatologist, they would go for some quacks for the joint pains, and they would prescribe them something which is laden with painkillers and steroids and everything, and they will directly come up with CKDs to you. And that is the time you really can't help them, because already most of the kidneys has lost its life. You'll have to put them up on dialysis or offer them a transplant option. But it becomes very frustrating to see it happening very commonly. I would say that out of 10 people I see in the OPD per day, at least 2 would be coming up with this kind of a thing, where some quack had prescribed him some bizarre funny thing, and they have been consuming it unwittingly for past few months or years.
Okay. Thank you very much. Now I open it. Any other question anybody would like to ask? Just raise your hand, please, because the time is short. So yes. Advocate, Rotarian Advocate Ramesh Sharma, please.
Firstly, I would like to thank Dr. Isha for a very nice presentation. But what I feel, generally in our society, there is a fear for donating any organ, including the kidney. And there is no program of awareness of the people to remove this fever. I too want to know what may be the complications for a donor after donating a kidney, and whether a donor can donate second time also or not.
So talking about kidney, living donor, sir, cannot donate the kidney again, because we are born only with 2 kidneys. One kidney, yes, it is enough for you to survive and have a very normal life. But the second one, you have to retain it to yourself. You can't donate it again. Other than that, there are hardly any complications which happen to a donor. The precautions which somebody has to take when they have 2 kidneys are similar to what they have to take when they have just 1 kidney. So you don't have to take painkillers, less salt, lifestyle, get your BP, diabetes, sugar, everything checked every year at least after the age of 40. All those things are to be taken care of by a donor also, like somebody else would do. So there are no extra special precautions. There are no complications. Sometimes, very recently, when transplant, which we had performed 4 days back, there the donor had some anatomical issues which were not even seen in the CT scan which was performed before surgery. It was seen only on the table. But yet, that kind of anomaly also, which we are trying to publish in medical journal also, it's a very uncommon anomaly. Even with that, the surgery was very successfully performed, and the donor was discharged yesterday after 3 days, and she is doing perfectly fine. So that tells us that donor surgery for at least kidneys is very safe, because kidneys are not located intra-abdominally. They are located at the back. They are retroperitoneal structures. They are very easy to remove and very easily visible, and it is done with a laparoscope. You don't have to give a big scar or incision also. With 2 small scars also, with 2 small incisions, you can perform this surgery very easily.
Okay. Thank you very much, Advocate Sharma. Any other question, please? Otherwise, I'm giving to. Okay. I think Rotarian Pratul Agrawal would like to ask. Yes, please.
Welcome, Dr. Isha.
Thank you, sir.
And, you are dealing with a very sensitive profession. How much secure you feel? Because there are many legal complications with doctors also.
Right.
And
See,
what precaution you take?
I'll tell you a very funny thing. I actually used to handle all the calls which I would receive for appointments directly until few months back, when people would simply try to find my number. Random people from random states, random places would just call me up, and they would say that paisa nahi hai mere paas, kidney dena hai, lenge kya? It became so troublesome for me that I actually had to hand over my phone to a secretary to deal with all these kind of nuisance. So yes, it is definitely very sensitive for us also, and we ensure that nobody who's involved in a monetary exchange in lieu of kidney comes to us. Only family members are encouraged. We see the relationships certificates. We see their HLA. We try to match whether or not the relation they are claiming is true, and only then we go ahead with all the medical procedures. So yes, it is very difficult, but in the seeing the better good of people, we have to get into it.
Okay, thank you very much. And I can also say in a lighter way, my calls was also directed to her secretary, and sometimes she has not picked up. So I presume that she feels that it's a.
I apologize for
No, it's okay. Thank you very much. Over to you, Rotarian Pratulak.
Thank you, Doctor. You have very coolly and calmly apprised us of a very complicated issue. And now I request Rotarian Nitin Gupta to give the vote of thanks.
Yeah. So thank you, Dr. Isha Tiwari, for a wonderful and very informative talk today. And we'll hope, we are so happy that you are working in Indore, which is hometown, had been a hometown for almost 40 years. And at that time, anyone for dialysis would be referred to Jaslok Hospital, Bombay. And then at that 40 years, 50 years back, there was no facility. But I believe now with you there, Indore is in safe hands for the kidney
Thank you so
disease.
much, sir. Thank you
Thank
for
you
your
so much.
appreciation. Thank you.
Yeah, thank you.
Meeting is adjourned.